Two of the mobility drills that we're going to cover are going to be the PSOAS, which is going to be, so your quads form into your hip flexors form into your PSOAS, which comes up and attaches to the lower 5 vertebrae, and your Iliacus, which kind of runs on the inside of that pelvis. So to work on it, you can get a tool called the PSORITE, P-S-O-R-I-T-E. And if you find your hip bone, we're going to start with it just on the inside of that hip bone. So we're going to use gravity to add some pressure. So I'm going to find my hip bone, top of my hip bone, and I'm going to start just on the inside of that hip bone. And I'm just going to, you can start on your chest, and it's a little bit less pressure. If I angle it in towards my pelvis, it's a little more my iliacus. I can angle it a little bit more towards my belly button to work a little bit more on my psoas. And just breathe. Inhale, you try and press the PSORITE into the floor. Exhale, let the PSORITE sink into your soft tissue and let it relax. Inhale, stiffen up into the PSOAS, into the PSORITE. Exhale, relax, and just let it sink into the muscle like Swiss cheese. So we're training our central nervous system to fire and then relax. And it's helping to get the PSORITE to sink a little bit deeper into the PSOAS and the iliacus so that we can release a little bit more and get a little bit deeper. Now once you do right on the inside of your pelvis, if you want to go a little higher, you might have to go a little bit more towards the spine to find your PSOAS. And it takes some practice. It's going to take some hunting around to find that tight band that's your PSOAS. And then once you press into it, you can kind of roll a little bit. And then exhale and let it relax. And then to work more on your iliacus, you want to stay closer to the pelvis and angle it a little bit more into the pelvis to work on both those muscles. So take some practice finding it, but releasing those muscles, especially the PSOAS, because it connects directly to the spine. If that thing's really tight and it's pulling on your spine, that could be a cause of your back pain. So we got to do some mobility to get that PSOAS on both sides to relax. The other reason what's going to happen with your PSOAS is because when we sit, right, this is our quads, hip flexors, PSOAS, iliacus, and this is them fully open. But when we go to sit, we're shortening our PSOAS and our hip flexors all day that we sit. Not only that, we're trying to stay upright, and so our PSOAS is kind of fighting all day to create some stability while we're sitting, and so it's overly fatigued and overly tight. So anybody who sits or has been sitting, growing up since school, since elementary school and high school and our jobs, we sit so much, we really got to spend some time either going to see a professional who can dig in and they know how to release it, or getting something like the PSORITE and spending some time laying on it and breathing and learning to control and relax our PSOAS by having our central nervous system communicate with the muscles through breath work to release our PSOAS. So that's for the PSOAS. The next one will be for the QL. So for the QL, or quadratus lumborum, it's going to start from our lowest rib, and it's going to also attach to our lower 5 vertebrae into our pelvis. So this bit of meaty tissue, kind of on the outside of our spine, so there's our erectors just to the outside of our spine, and just to the outside of our erectors, under that lowest rib, all the way down to our pelvis, this is our QL. So you can start on your erectors for this mobility piece, and then you can move it a little bit laterally, so that means towards the side to work on our QL. And then you can start working your way down towards the pelvis. So it's not a whole lot of range of motion you have to work with. So just this little area. So I'm going to start with the ball just to the outside of my spine, which would be my erectors. And then I'm going to pull this knee, I'm going to lift my hips and pull this knee to my chest. And then I'm going to sink down using the weight of my body to press into my erectors. And I'm going to inhale, I'm going to stiffen up my erectors, and I'm going to exhale and let them relax. Inhale, stiffen them up, tighten up my erectors, exhale, relax my erectors. And then if I turn a little bit 45 degrees, now the ball's moved to the outside of my erectors, and it's underneath my lowest rib, and it's above my pelvis. So I'm working on my QL. So gonna inhale, stiffen up my QL, exhale, relax, and let the ball sink into my QL. And the more I can bring my knee to my chest and kind of round my pelvis into some flexion, the more space I'm creating for the ball to be able to work on my QL. So I inhale, tighten up my QL, exhale, relax into it. And you could just stay here and breathe and just try and relax and let the ball sink in. You could try a little bit more lateral and see if you feel if you feel tight there, if you can get your QL still there. Go a little bit lower. You can work your way back medial, back towards the spine. Just working on breathing and sinking into the ball and freeing up that QL so that it's not pulling on the spine and so that it can work properly and do its job to create stability.